As we're gradually moving back to opening schools and businesses and, of course, our in-person interactions, I want to remind you, this is all time with cold and flu season getting going. Staying hydrated is key to helping your body deal with the added stress and with the upcoming flu season. My regular fans have heard me talk about a product called Hydrolyte for a long time now. It's an amazing rapid rehydration drink. It's a mix that, well, we're obsessed with here. I'm excited to announce they've just released Hydrolyte Plus Immunity, just in time for cold and flu season. Hydrolyte Plus Immunity starts with their fast-absorbing electrolytes and adds a host of immune-boosting ingredients. Each single-serve, easy-pour drink mix contains 1,000 milligrams of vitamin C and 300 milligrams of elderberry extract, creates what is hopefully immune-boosting formula that's high in antioxidants and zinc. Combining this with Hydrolyte's 7 key electrolytes, it's a fantastic way to stay proactive and properly hydrated. Hydrolyte Plus Immunity comes in convenient, easy-to-pour powder sticks that rapidly dissolve in water and make a great tasting drink that has 75% less sugar than your typical sports drink. It uses all natural flavors and it is gluten-free, dairy-free, caffeine-free, non-GMO, vegan, and you can find Hydrolyte Plus by visiting hydrolyte.com/Dr. Drew. Again, that's HYDRALYTE.com/DRDRW. And be sure to use our code Dr. Drew 25 at checkout for a special discount.
Hello, everyone. It's a dose of Dr. Drew.
Hey, you caught me typing on the restream there. Thank you, guys. Let me just answer some very quick questions that's already on the stream here. Mark, I'm going to ask you to ask me the question again, and Susan, keep an eye out for Mark Gill.
I'll grab it.
I believed he asked his question yesterday, and I answered it, but he must not have heard it. And then Ashley, who was one of our winners the one time, asked about the difference between sarcoidosis and lupus. These are very, very different illnesses. Both have autoimmune features, but sarcoidosis, it causes what are called non-caseating granulomas. It's a granuloma.
I'm glad you mentioned Ashley because she didn't get her prize.
Ashley with an extra E.
So she has to email me. We'll talk about it after, but let's introduce our guest.
Lupus, obviously, is an autoimmune disease, a very specific syndrome of attack on many different aspects of joint and muscle and heart lining and that sort of thing. It's characterized by an attack on DNA. But that's about all I have time to get into because I want to bring my extra special guest in here, Dr. Vladimir Zelenko, who's on the move while we speak to him. And I encourage him to stay on the move, although I see he's already pulled over. I think you can safely talk to us while you're driving, but that's up to you. Dr. Zelenko can be followed at Zev, Z-E-V _Dr. D-R. There's just D-R, Zev _DR. And of course, Dr. Zelenko is famous for having advocated on behalf of various early interventions for COVID that he's had great success with. And for some reason, that whole phenomena has become politicized. But there's always interesting things to talk to with Dr. Zelenko. Dr. Zelenko, welcome to the program.
Thank you so much, Dr. Drew, for having me.
So maybe you should just update us where you are now. I know you've been putting out various op-ed positions. You've now got a peer-reviewed article out. Just bring people up to speed where you are right now.
Well, we have developed a very effective, safe treatment for COVID-19 in the pre-hospital setting, which essentially eliminates the need for hospitalization. And this has now been published in the International Journal of Antimicrobial Agents, and peer-reviewed. And interestingly enough, yesterday there was
hold on, Dr. Zelenko. My restream is saying they can't hear him. I hear him extra clear. Like I wanted to know what car you have because
let me turn it up.
The microphone is exceptionally clear, but
it's a Mercedes SUV.
It's really clear. But on our end, it's not going through properly. So let's turn it up.
Okay.
Let's have Dr. Zelenko. I'm going to have Dr. Zelenko count to 5. Dr. Zelenko count, and then you guys tell me if you're hearing him. Dr. Zelenko.
1, 2, 3, 4, 5.
Okay, now you guys tell me if that improved things or not.
Yeah, for some reason the cable A Zoom is not working.
Even right now. Hey, ASSO 280. Obviously, I'm not supporting distracted driving, but I do believe people can't speak and drive at the same time. Have you ever driven with someone in the car with you and talked to them? It's the same thing. Okay, they're still not hearing you.
Oh.
This is actually a big issue.
I know. We have to be able to hear him. added.
One second, she's dealing with
Oh,
the
there's
technical.
2 of them in here.
Faith,
on.
if someone has COVID in the same house, how do I keep my 8-year-old daughter safe? Faith, it's the same practice you would. These sick people get quarantined. That's how you deal with sick people. You quarantine them, and you certainly don't have any contact without mask and distancing. And you need to hand wash. And when you have somebody you know is actively ill, you might want to be extra careful with maybe some eye protection, good mask, like an N95, and careful hand washing. So just do what you know how to do. That's all.
Okay, let's see if that helped.
Lots of love for Dr. Zelenko on my research. So we have a chat, Dr. Zelenko, here where I can see people's comments as we are talking. And
But he needs to talk so I can see if it works.
go ahead and count
Hello.
to 5 again.
Yeah,
One,
it's
2, 3, 4.
1, 2, 3, 4,
It's
5.
coming.
Okay. And Jason, yes, monoclonal antibodies are available at hospitals by 2 means. Well, several means. One is, of course, convalescent plasma, but the other is a monoclonal antibody from Lilly and then a polyclonal antibody from Regeneron. These have all been approved. Hang on one second. Dr. Zelenko, I apologize.
Okay.
No worries.
Try again.
Sheesh. I don't know why that's not.
I don't want to waste his time. So.
I know. I don't know what the deal is. We could just stop it and start it up again. See.
I'm wondering if maybe I could get just 3 or 4 minutes with Dr. Zelenko myself. You all can sit and watch while I get the information, and I'll tell you what I've learned. That's all another way of doing
Oh my
this.
God, this is so frustrating.
You want me to redial in, see if that helps?
I mean, we can hear you fine. It's just not going through.
I think it's a reset of our. It's as always. It's that broadcaster. I'm sure of it.
I know. I clicked it. Let me go in here. All right. Cable A.
Well, while they're not hearing us, they can hear my end of the conversation at least. What's coming? What's up for you next? Where do you occupies you?
Well, yesterday was a very big day. There was a hearing in the Senate. Senator Ron Johnson, who is the chair of the Homeland Security, organized a hearing about specifically pre-hospital intervention
And
for COVID.
you tweeted that too. That this is Senator Ron Johnson, right? He's a senator, and he was talking about allowing physicians to practice medicine. That's really what his point was, and that's kind of always been your point too. Is let us do what we know how to do without politicizing it. Correct?
Correct, and more than that, get out of the way in a sense from obstructing life-saving information and creating propaganda and fear mongering for well-established safe medication.
Now, I am more persuaded these days that if I got sick, and by the way, I have the full spectrum of the what you advocate in my home, ready to go if anybody gets sick. But I'm sort of persuaded that I would take ivermectin if I got sort of early symptoms. I'm not in a real risk category. I'm approaching it. I'm flirting with risk. But I think I would go on ivermectin and doxycycline. Is that the right way to approach, a 60-year-old with, really limited risk factors?
So the innovator of that who published on it is Dr. Brody from Australia. And he had tremendous success with ivermectin and zinc and doxycycline. The exact mechanism of action of ivermectin is not yet clear. I mean, it's an anti-parasitic agent, but how it works in anti-COVID properties, we don't really know, but it seems to be effective. But he admitted that the reason why he chose that protocol was you can go to jail in Australia for prescribing hydroxychloroquine.
Wow.
So he had for a year.
Wow. Now let's that's insanity. But let's talk about hydroxychloroquine for a second. And Susan, what I'm hearing now from the stream is that it's volume. They can hear him, but he's at a whisper. So if you could turn up his volume somehow. So New England Journal, I haven't yet read these articles, but they just put out a whole series of them on hydroxychloroquine in hospitalized patients, of course. Any thoughts on some of the literature that's coming out? Is anything of interest in the double-blind controlled studies been useful to you?
No, because all those studies, even 2 weeks ago, the NIH came out with a recommendation not to do any intervention in the pre-hospital setting unless, and not even in the hospital setting unless the patient is desaturating or his oxygen level is dropping. These recommendations are outright murderous, and these people have narratives and agendas that are not in the best interests of humanity. So
I have to say, it's what I saw coming at the beginning was the panic that everyone was in, and that people. I just kept saying, just listen to the CDC. Please listen to the CDC. You don't know what you're doing. You have no experience with this. Just listen. And I know you may have issues with what the CDC is saying, but the fact that it's bled outside the CDC, where school boards and mayors and governors are making these decisions that are grotesquely distorted. I wonder how you feel about that.
I think that the world experts in successfully treating COVID-19 should set policy, not administrators or academic physicians who haven't treated patients in years. And the reason why I say that is that we are in a world war situation, and I really mean that, because more than 200 countries are fighting the same viral enemy. And in such a pandemic, the usual way of doing things, which is taking a year and taking your time doing randomized controlled studies, is not an option. I'm not saying we shouldn't do it, but I'm saying that in parallel, we need to use the best available information to try to stop this plague. And for us to say that we're not going to use something that frontline doctors are seeing works because we don't have yet the scientific data to prove it is absolutely ridiculous. And who does it serve? I have now, it's not only me, I could tell you there's a group of doctors of us that collectively have treated over 50,000 patients, high-risk patients with COVID-19, with death rates that are absolutely infinitesimal. So how can you tell that to a group of doctors who are dealing with these patients on a day-to-day basis, seeing them survive? And we're talking about high-risk patients, and we know statistics also. I know what 10% of patients dying means. And when my patients don't die at 10% rates, but less than 1%, you don't have to be a genius to figure out that something's working. And when that's reproducible by multiple doctors across multiple continents. So when you sum together the collective observational data, according to Dr. Harvey Reish from Yale, MD, PhD from Yale School of Epidemiology, he says that the statistical power of the data in support of hydroxychloroquine is greater than anything else he's ever seen in the history of medicine.
Wow. Well, we do know. Oh, interesting. So I'm echoing. So let me put my earphone back in. Testing. Oh, I'm still echoing, Susan.
I know.
So now I'm echoing. But what's interesting to me is that, clinical medicine often precedes research. Often. That we find out through research long after we've been using a particular medication in a particular way. Do we get the research to confirm, to sort of give us the evidence basis for what we need to do to use these things with great certainty? And that seems to have been completely abandoned. They're completely abandoned in this particular situation. How are you looking at the numbers now? Do you have any concern about the current surge we're in?
Listen, COVID-19, people are not dying from COVID-19. I have no concern about COVID-19. The reason why I say that is it's highly effective. It's easy to treat when it's in the first stage, in the upper respiratory stage, before it goes into the lungs and causes an intense inflammatory overreaction.
Right.
So it's easier to treat than influenza. It's safer on kids than influenza. The problem is that the treatment is not available, or the knowledge is not being shared. It's being actively suppressed. And so that's the people are dying. They say politics is a blood sport. I didn't realize how literally you need to interpret that. Because the streets of the world are flowing with the blood of the elderly and the vulnerable because of the suppression of life-saving information. It's not the COVID-19. So my concern is why in this, in the United States has more deaths than I believe most of the world summed together. So why is it that you have countries like Uganda with 44 million people and they have only 40 deaths. Why is it countries like India that have, I think it's 70 deaths per million compared to 900 deaths per million to America? Why is it that we, the most developed country in the world, are seeing such ridiculous mortality? And the answer is very simple. We are affluent. And since we're affluent, we have the luxury to kill people with expensive treatments and the suppression of cheap treatments. Okay, the treatment that I'm advocating, not only is it safe, but it costs $20 and can be administered at home. It's pills. No, in these rich countries like we live in, the temptation is to offer $3,200 treatments like remdesivir, which the WHO, by the way, just said doesn't work. But anyway, so we're pushing off treatment for a week or two until patients get really sick, end up in the hospital, and by then the mortality rates skyrocket. The problem is that we are being we're being obstructed. Life-saving medication is being obstructed from the American people, and it's an outrage. It's a crime against humanity.
Are you concerned about the curfews that are being imposed?
More people are dying from the lockdown, actually, than anything else, and I'll explain to you why. First of all, there's a lot of collateral damage. Because of the lack of access to care, people are dying from preventable illnesses that they used to not die. From routine care, cancer screening,
right.
Routine hip replacements, getting stents. There are routine medical care that people are not getting because of fear of going to the hospital or lack of access, and they're having a lot of morbidity and mortality because of that, number one. Number two, the suicide rates through this country have skyrocketed.
Yep.
The amount of child abuse and spousal abuse have skyrocketed.
Yep.
So a lot of psychotrauma, all the damage psychologically from losing your livelihood and uncertainty has skyrocketed. So we're dealing with a tremendous amount of collateral damage, number one.
Yeah.
Number two, the way the immune system works in general is through exposure.
Right.
By being exposed to the myriads of pathogens and overcoming them with a normal, brisk immune response, you make your immune system stronger. By isolating yourself in the fear, because of the fear of getting COVID-19, what you're doing essentially is you're weakening your immune system. So I completely, if I had my way, this is what I would do. I would open up absolutely everything. There will be no quarantines. There will be no masks. However, on every single corner of this country, I would have available the life-saving medications, and the high-risk patients who develop symptoms, they should be treated immediately and or prophylaxed before they get it. See, the problem is, well, the statistics are 99.97% of the people that get COVID-19 recover. And the reason why is that most people are healthy, their immune system is just fine to get rid of it. It's the high-risk category patients, the elderly, or those people with chronic medical problems that have the 5 to 10% mortality rate. So we have to deploy our resources in that group, not shut down the entire country and world, but rather give special attention and treatment to those patients that have the high risk.
Yeah, I mean, that makes perfect sense to me. I again, the whole thing, the way we approach this thing has been sort of astonishing to me. Nothing short of astonishing. I'm bewildered by how we've, and also the way we approach people, it abandons the way we know how to do health messaging. I don't know about you, but I was very involved in the AIDS epidemic. And if you remember back then, we were trying to change people's behavior so they didn't die. And we spent 20 years figuring out how to do that. And we just completely abandoned that in this particular epidemic. It's so weird. We didn't say, hey, you have sex, you're going to kill somebody. You're killing those people you have sex with. We never said that. Can you imagine if we had said that at the time? It's just unspeakable. And yet that's what we're doing now. You're killing grandma if you go out of the house. Like, really? That's good health messaging? That's the way to do this? It's too much, right?
Listen, let me talk about myself because I know what's going on. I'm immunocompromised. I have one lung, and I practice medicine with no mask. I have zero fear in coming in contact with patients with active COVID-19. And the reason why I say that is because I prophylax myself. And I see that the results are incredible.
What do you prophylax with? What are you taking?
Hydroxychloroquine and zinc.
How about quercetin and zinc?
So Yes, I recommend. I was the first actually to recommend quercetin and EGCG, which is a green tea extract. The thing is, those are second-line drugs, and I'll tell you why. Hydroxychloroquine has 4 unique mechanisms of action that help against COVID-19. One is the zinc ionophore property, which it gets the zinc, the bullet, into the cell to kill the virus, and that's where quercetin and EGCG share. It's the common denominator amongst all of them. But in addition to
one
that,
second. Guys, you can turn my headphones up and I can just hold them up to the mic here. So do that in the meantime, please. Okay? Turn my headphones way up. Okay. So go ahead. Keep going.
hydroxychloroquine also has other mechanisms of action which are very beneficial, like it stabilizes red blood cells. So the problem with COVID-19 infection that gets out of control is hypoxia. So if you stabilize red blood cells, you make them more effective in transporting oxygen. That's a good thing. Number 2, it changes the pH in endozymes, which decreases the amount of virus that actually gets into the cytoplasm. And number 4, I believe it inhibits the cytokine response. So there are multiple beneficial mechanisms of action to hydroxychloroquine. That's why I prefer to use it. However, living in the real world, when you can't get it, so then obviously we revert to plan B, which is using quercetin or EGCG together with zinc.
You still at 25 milligrams of zinc?
So define what we're doing. If we're treating or prophylaxing?
Prophylactic.
Yeah, so 25 a day is sufficient. For treatment, I double that.
So you're 50 if you're treating.
Correct.
Yeah, I'm sort of, I've got ivermectin, zinc, and doxycycline standing by, but hydroxychloroquine is here. I mean, early on, I saw how many people were using it to good effect, and so that's why I made it available. But now it's hard to get.
Let me share with you. My approach has changed over the last 6 months. Each patient is getting a custom assessment and treatment plan, and what I mean by that is that, let's say someone comes in, they're moderate risk, they've been sick for 10 days now, and they're developing pulmonary symptoms. So at that point, I would use hydroxychloroquine, zinc, and azithromycin, but I would also throw in ivermectin and steroids and anticoagulants.
And when you say anticoagulants, there was a study that came out a couple weeks ago, about a week ago, that showed, and I know, let me put it this way, I've seen lots of full anticoagulation fail. The traditional anticoagulation, whether it's Eliquis or Coumadin, but there was a study that came out about a week ago that showed persantine to be a very good use, and it was a very compelling study. Did you see that?
I did see it. I haven't yet incorporated it. I'm kind of comfortable and have good success with Eliquis. It's oral and it seems to be well tolerated.
Do you do a full dose, like 5 milligrams twice a day, or 5 milligrams once a day? What do you do?
5 BAD twice a day.
Yeah.
And what I do is, but the key is not to let it go out of control. It's the anti-inflammatory cytokine response that causes, one of the cytokines causes increased clotting. So the idea is to prevent that response. Now, if a little bit gets out of control, you can anticoagulate. However, if it's fully out of control, the patient really probably deserves to be in the hospital.
Yeah.
So the key is not to, if any of my patients end up in the hospital, I view it as a treatment failure on my part, if they came on time. So most of my patients, I'm able to manage them in the outpatient setting at home. I get them IV fluids, I get them home oxygen concentrators, very strict follow-up, and I do whatever I can not to send people to the hospital.
Now, you said, I know you've had a sarcoma removed, you have a lumenectomy, you have one lung. Are you going to take the vaccine when it becomes available?
So I'm a good candidate for the vaccine, but there's a very limited population that the vaccine would be useful for. Basically, the high-risk patients. Those low-risk patients who have a 99.97% chance of getting better, why would I vaccinate them? I would actually want them to get the
but that's not you, right?
That's not me. Right.
That's not you, yeah.
That's right. So if there was an ideal vaccine where safety and efficacy was well known and studied, I would take it. Now, what's happened is this vaccine, which I understand has been pushed through really fast because of the nature of our pandemic, which fine, I understand, but its safety and efficacy have not yet been fully, in my opinion, vetted. And since I have a approach a prophylactic approach that seems to work extremely well, I'm not going to be the first guinea pig for it. Now, there's also other problems with this vaccine. It's an RNA vaccine which has never been used on human beings.
Well, that's not true. That's not true. They used it for Ebola. They've used it in other countries. They've just not used it in this country.
Well, how did it work out for Ebola?
It didn't hurt anybody.
Okay, I can't correct it, but still, we haven't had an effective RNA vaccine.
We've not used it.
I know of.
Not in this country. That's for sure. So listen, I know you had limited time. My time is up. A lot of people on the stream are not hearing you because of a technical issue, but we will upload this entire episode where you will be able to get the sound. My technical people are over there working hard, and they promised me that will be the case. So tune back into that.
We even have an
expert
idiot
here.
Savant
Yeah, I know.
tech guy here, and he can't figure it out either. So it has to do with OBS does this occasionally. But Dr. Zelenko, we will upload this entire interview, and I hope that you have a nice evening. And
yeah, thank you. As
so
always, I appreciate your spirit, and I'm gonna let you conclude as you often do with a defense of exactly that spiritual practice. So I always like your thoughts on the fact that we're all being prevented from spiritual congregations right now. Why don't you just give us your thoughts on that before we let you go?
Yeah, so look, blessings of God is really what keeps someone healthy. And by shifting this country into a more, let's say, God-centered society will only bring vitality, light, and a good spirit into our lives. By running away from the divine, no one ever benefits over time, in my opinion.
And to that end, people are wishing you the best. They love that you've recovered from your operation. You look so well, and
I've added the link to his peer review that
this is his peer-reviewed study we have up on the screen right now.
You can find the link on YouTube and also on Facebook, and then I'll post it at the end of this here for you guys to have. And then we're gonna turn off the computer and make this its own interview in itself, and then I'll re-upload it on YouTube and Facebook so people can hear your voice. So thank you again. I'm sorry for the snafu, but we'll have you back soon.
Dr. Zelenko,
good Shabbos and God bless you.
Good Shabbos. We'll see you then. And we will be back again with our restream and with a live stream once this technical issue has been solved. Should be just a few minutes, I suspect.
Well, we can hear you, but I just want to save this interview
Make
and
sure
then
you've got it.
not have to upload the entire
and
thing.
Can we put this whole thing over on Locals too, by the way, once we've got it? They're asking about. They're asking also for the article on Locals.
Yeah, I'll send the links and put it all out there.
Okay, and
we'll be right back.
We'll be right back. So stand by, everybody. And by the way, if you want to stay on the reach stream, I'll just keep chatting with you here until we get the stream, until we get the visual stream back.
Oh my gosh, I'm so sorry, you guys. That was so weird.